Now, for the radiographer, it's not all about I just want to image this patient and okay. So as a radiographer, you're actually meant to have a connection with the patient that comes to you for imaging. Okay, you always have connections with them, and you always treat them as though you are in their shoes. You understand? This is kind of like part of the ethics. Okay, patient safety is number one. So let's quickly look at all the responsibilities that a radiographer has to actually what will I say deliver to the patient. Okay, so responsibilities of the radiographer to the patient. All right, so it goes beyond just producing images. You have to balance your technical expertise with compassion. This patient is coming there, probably this is their last money they are spending just to get an imaging, so you have to be kind to them. So patient responsibilities of the radiographer include you have to confirm the patient, so identification and verification, because you don't want to take an imaging that was meant for a different patient and give it to another patient. Okay, communication and consent. When the patient comes, you have to introduce yourself, you tell them why they are going to do imaging, you explain to them that it won't take long, there's no pain, you calm the whole situation down. So radiation safety, you have to make sure that that patient is exposed to just the amount of radiation that is needed to diagnose their issue, and you are not just trying to just expose them to whatever type of radiation. You are trying to put their safety first. Okay, so we have as low as reasonably achievable principle. So just what is little enough to just give you the diagnosis is what you need. So patient comfort and dignity, the patients will have gowns, drapes, and you shouldn't be videoing them with your phone. Even if you do it, you have to ask for consent and they have to agree. Infection control, so the whole places should be neat, aseptic procedure, so that you don't want the patient to take off from infections. And make sure that your patient is in the right position that I can get the best imaging, and it's immobilized. The patient is not shaking anyhow. If they shake anyhow, you have an image that is blurred. Do you understand? An image that is not clear. You understand? So monitoring and emergency preparedness is you'll be observing the vitals of the patient, because sometimes a disease condition could exacerbate in the radiography room, and the radiography person should have that knowledge to at least be able to deal with emergencies too. Okay, so post procedure, ensure that the patient is stable before leaving the image room. Okay, and follow up with your patient. Sometimes you mustn't only see them in the radiography room, you can walk to their hospital ward and say hi to them. Do you understand? Let's try to develop a personal rapport with your patients.